for them today. And we'll go ahead and move on to our last poster presentation for the day. Certainly last but not least, we have a presentation from Veronica Parham-Dudley from BridgePoint Healthcare, who will present on the successful management of COVID-19 at BridgePoint Healthcare. Veronica, take it away.
Good morning, everyone, and welcome to our Patient Safety and Quality Summit for 2020. I wanted to share with the group today just some of the challenges as well as the successes that we've had at BridgePoint during this COVID pandemic. BridgePoint has been an experience for us. As you know, BridgePoint consists of 4 separate facilities within the DC area. We have 2 long-term acute care facilities as well as 2 skilled nursing facilities, which brings up our first challenge, which was how to manage this pandemic in facilities that had mixed use. We know that the coronavirus was newly discovered, but that the best way to slow down the transmission was to make sure that all of our staff were well informed about the disease, how it was spread. So we relied heavily on the CMS and CDC guidelines that related to each of our facilities. Our beginning of this experience started with our leadership sitting down to talk about what changes needed to be made in our facilities to deal with the pandemic. So we established safety protocols for dealing with COVID at the BridgePoint healthcare facilities. One of the methods we used was to begin looking at our use of PPE in anticipation for the pandemic. We made sure that we had all of the appropriate PPE in place and made sure that all of our staff knew how to don and doff the PPE that was needed. In addition, we increased our infection control awareness for the entire organization. We made posters, we had signs, we had models. We used everything that we could to make sure that all of our staff were well informed about infection control practices. We did in-services for all of our staff, EVS, maintenance, facilities, across the board, in addition to our clinical staff. Over the 2 months that we conducted weekly testing in our skilled nursing facilities, and this testing has continued per CDC guidelines. We continue to do testing in our skilled nursing facilities on a weekly basis. We make sure that all high-risk employees were vetted, and were allowed to work at home as much as possible. We established a visitors policy, which was very different from anything that we had done before, which was limiting visitors. So we've been looking at that based on the district's transmission rates, and because we're still in phase 2, we continue to have no visitors at this time, but we will probably institute resuming visitors very soon. One of the things that we paid a lot of attention to was looking at our transmission rates, and we have been very fortunate. Our staff has been very diligent, so you can tell by the chart. We have about 250 patients total at each of our facilities, and our transmission rate and our number of COVID rate has been at less than 0.04%, which is amazing. I give it all of the credit to our staff, the vigilance of our physician staff, our nursing staff, in making sure that the COVID virus has not been spread throughout our facilities. We've been looking at all of our cases on a weekly basis, and we maintain it. At one of our facilities, we continue to have 0 numbers of COVID, and at the other, we have, I think the most that we've had at any given time has been 5, which is like 0.035%. So we're really happy that we have been able to contain this virus, and we continue to do so. We continue to look at the use of PPE. We continue to do training on a weekly basis to make sure that all of our staff are aware of any new policies and guidelines that come out from the CDC and that come out from the district. We're very thankful that our leadership has been so supportive in making sure that our staff have had all of the resources they need to make sure that all of our staff as well as our patients are safe. And with that, I would entertain any questions.
Thanks, Ronnie. I actually have a couple that have come in already. Very interesting. And I think, you know, with everything going on, very timely, quite frankly. One of them is actually around how did you engage your staff and keep them motivated, you know, address morale, address turnover, those kinds of things? What were some of the successful things that you think you did?
Yeah, we've been really happy about the engagement of our staff throughout this whole pandemic. Our leadership was right on the spot with making sure that we did everything that we could to keep up morale. We've had, you know, snacks for staff throughout every shift. We had free meals for staff throughout. We tried to celebrate our staff throughout this and keep them motivated. And we're happy to report that we had zero turnover due to COVID. Our staff stayed with us, and help us with this fight. So I think it has to do with our leadership being on the ground and being supportive of staff.
Thanks. You know, yesterday's presentation, I don't know if you were able to attend, I'm sure many on the call were, was about resilience. And that was one of the things that really came up is like, how do we support staff during this to help prevent burnout, manage stress, and the fear, quite frankly, that, you know, many of us face every day with this. I think given that, this next question might actually make sense. What are your plans for continued management during COVID? Do you see anything sort of changing on the horizon or anything that stands out as things you're going to be doing in the near future?
The only thing that we see changing in the near future is that we will resume having visitors. We understand and have been keeping a tight gauge on the impact that not allowing loved ones to come in to visit has had on our patients and our residents. So we know that very soon we will resume in a limited way to have patients allowed, you know, have their families allowed to come in and visit. And so we're already in the process of, you know, making sure that our staff knows, you know, how to keep our patients safe. We have screening at the door. We're doing temperatures. We're doing, you know, monitoring people who travel outside to hot spots. So we know that once we introduce visitors back into our facilities, that our staff will have to be more and more vigilant in making sure that our visitors keep safe as well.
Yeah, this must be a great topic. I'm getting questions in faster than I can answer them. So we might have to have you go on chat when we're done and chat with some of the folks in the audience. Hot topic, I think, for good reason. Somebody actually asked a follow-up to my question. Any long-term policy or workflow changes? You know, we've instituted a lot. We had things in place when we thought epidemic, pandemic might happen. And then pandemic happened and we sort of scrambled to figure out, you know, those gaps that perhaps we didn't realize we were going to have. Are there some things that you guys think you're going to keep longer term to sort of address these kinds of things, either just because they happen to work really well and you like them, pandemic or not, or to try to address potential future issues?
Well, I think part of what we've seen as an impact on our nursing staff in particular during the pandemic has been that nurses have been freed up to do a lot of other things. So I think we're going to relook at our visitation policies over the long run, and just the vigilance that we've taken with infection control and making more and more staff in every single department aware of infection control and the importance of keeping patients and staff safe. I think those are practices that we will certainly continue.
Great, thanks for that. We did have one additional question. I'll make sure Julie gets that to you, so maybe you can chat some answers. I think some folks are looking to network on, staff who got COVID and, how that sort of worked if that happened. And maybe that can proceed in chat as you guys see fit, given the nature of the question. But I really want to thank you for giving this presentation, just very timely. And I'm glad, we were able to include this piece in our work.